Hello, welcome to mricardiac.com, another session of improving CMR image quality. And today we will deal with some common issues. So claustrophobia is one of the very common problem while doing cardiac MR. Patient education and reassurance is very helpful. Allow a relative to accompany the patient, maintain verbal contact during the scan, and also we can give headphones with some music. Mild sedation can also be given while doing cardiac MR. And if none of these works, scan can also be performed in prone position. So at least patient is not looking at the gantry. It is a myth that 3 Tesla images are always worst as compared to 1.5 Tesla. 3 Tesla machines would have an advantage of increased SNR, faster acquisition time, higher parallel imaging techniques, and also they provide reliable flow measurements in small vessels. However, they have a lot of off-resonance artifact and more issues with ECG gating. So because of this, 1.5 Tesla is preferred, but if you work on your parameters, you can still get good images on 3 Tesla machines. Most importantly is tackling magnetic field inhomogeneity. So correct coil placement and adequate shimming is very important. So you should make sure that the center of the coil should be aligned with the center of the heart for good SNR. So always verify the coil position before you start the scan and apply shimming, dedicated cardiac shimming over the heart. So as you see in this green box. Off-resonance artifacts are always a nightmare in 3 Tesla machines, and especially choosing the right frequencies, we can still get away from the area of interest. So in 3 Tesla, it is always important to obtain a frequency scout, and with multiple frequency, you can choose the right frequency where the area of interest is clear of the off-resonance artifact, and then apply and do the scan. Another idea we can do is switching over to spoiled gradient echo sequences. Balanced SSFP sequence are the mainstay of imaging in cine MRI, but sometimes they are more prone for this inhomogeneity related artifacts. While gradient echo images, though they have poor SNR, but at least we can get good images, and it is more robust and less artifacts are seen as compared to SSFP. So main differences, SSFP have better SNR, but they are very sensitive to magnetic field inhomogeneity. Especially on 3 Tesla, a lot of off-resonance artifacts can be observed. While spoiled gradient echo, they are more robust. They are preferred whenever there are susceptibility artifacts, like especially in cases of devices, and they are also good for the subtle turbulent flow. So this is an example of how SSFP images look, and this is a flash or a spoiled gradient echo images. So though the blood and myocardial interface is relatively less clear as seen on SSFP images, but we can still get the reportable images. Whenever there is a complex turbulent flow or any devices, switch over from SSFP to GRE. Like in this case of aortic stent, and especially in this case of prosthetic vial, switching over to GRE can be helpful. Another important area is late gadolinium enhancement. It is very important to get good quality LG images and with the ideal inversion time. So the TI scout is obtained for achieving to identify the correct TI values. So as you see over here, if the TI value is very short, you will get more grainy images. And if it is too long, then the myocardium will be more bright, and then you will miss out on this subendocardial late gadolinium enhancement. So choosing the right TI value where there is adequate myocardial nulling is very crucial to appreciate any small focal of hyperenhancement. In case patient has tachycardia, you can reduce number of segments in LG images, and in case with bradycardia, you can increase number of segments. For LG images, if there is no breath hold, switch over to multiple signal averages. Single shot images are very helpful. And even if there is no breath hold, patient has certain arrhythmias, you can still get good quality images. If the myocardium is thin or paper thin myocardium, you can use the standard TI value of 350 to 400 so that the blood pool will be gray, and then you can appreciate LGE. If there is a delay more than 10 minutes, you can still give another 5 ml of contrast, wait for 5 minutes and resume the scan with TI of 300. in the patients with sinus rhythm, but with tachycardia. So whenever there is increased heart rate, you need to reduce. So basically in cine images, reduce number of segments, and LG also decrease number of segments. While similarly, whenever there is bradycardia, you have to increase. So increase number of segments in cine and LG images. Similar concepts can also be found in our book, Cardiac MRI Simplified. Any feedback and suggestion, please mail us on info@mricardiac.com and share your feedback on my personal email address. Thank you.